Today we're going to be talking about why is TMS painful. Today with me I have Dr. Kevin Murphy, a man that 4 years ago I kicked out of my office. He came in, he made some pretty wild claims that I just couldn't wrap my head around. Come to find out, they were all 100% true. Doc, can you tell us a little bit about who you are?
Well, thanks, Cal. You did, in fact, ask me to leave. At that first visit, we're talking about treating addiction patients, and we had quite a bit of experience on those kinds of patients, and we're having good success. So I think you were hearing what you're seeing now. So I'm a radiation oncologist by training. My background was in neurophysiology prior to being an oncologist, and I specialized particularly in brain tumors in pediatrics and adults using a process called stereotactic radiosurgery. And we were, in a sense, trying to find ways to fix the brainwave pattern following radiation. And so TMS was the modality, and over time we personalized how we do that.
So Doc, why is TMS painful?
Well, TMS therapy, transcranial magnetic stimulation therapy, in its standard form, has a very high amplitude. Mm-hmm. The motor threshold is taken, you give more than the motor threshold or around the motor sensory threshold, which for some patients, of course, is uncomfortable. The magnetic field's placed away from the motor sensory strip to avoid seizure, but it's still a risk. In our hands with PRTMS, personalizing the dose, we can turn down the intensity by a logarithm. So at depth, we're getting a fraction of the energy that you're seeing with standard TMS. And with that, you're getting a very, very mild sensation on the skin surface. So it's not painful with PRTMS. There are some patients that complain with standard TMS that it can be disruptive and it's very noisy. Hard to treat pediatric populations. Kids that like autism and things have a hard time.
Right. So deep TMS, I see a lot of complaints that it's painful. Mm-hmm. Is that what you're kind of getting at?
Yeah, well, there are several methods for getting down to deeper locations. Mm-hmm. When you do that, you enlarge the magnetic field. When you do that, you create a larger activation of the cortex. So a lot of the activation really, or the benefit we think from having deep brain stimulation is by creating a larger effect in the cortex, in the brain surface, where all the gray matter is. So the cell bodies there are what we think are most responsive to the stimulation. So deep brain stimulation may have other benefits that are necessary in certain patients, but as a rule, we don't try and get down more than 2 centimeters in our patients. So we're trying to go down just to the gray matter junction where the spinal fluid layer can act as our conduit layer and propagate that signal throughout the brain.
Which lowers the pain in every session?
So the threshold requirement or the dose requirement or the intensity of the field can be much lower when you personalize the actual delivery because we're giving a frequency that is already native to the brain. We're finding its native frequency and amplifying it.
So you guys have been working on that for how many years?
So beginning probably in 2013, so 10 years now, we've had over 10,000 patients treated across the country. We're in 20 states or so with the software that we created from a company called Peak Logic, which I founded. And the Peak Logic software takes the EEG data, it goes to the cloud, comes to our processing server, it processes a protocol and delivers that therapy back to the user in the location where the machine is. And that allows us to get more access to more patients. The goal was, how can we get this to more people? We need to automate the process, automate the prescription process. So we're providing a prescription for personalizing TMS with PRTMS.
Hey guys, if you found that video informational, want to see more, do me a favor, click this video right here while I enjoy my TMS sessions. Did you click it? Click it already. TMS, it's life-changing. This video right here is going to help you.